Okay, so what we're going to talk today about two methods of diagnosis in Chinese medicine, not all the methods of Chinese medicine, but I'm sure that you happen to go in the clinic, if you have experience with acupuncture, you have your private acupuncture that you see. You guys got a treatment, correct? You know, you've never gotten acupuncture before.
Just in my kid's doctor's office, she gave me.
Oh, she gave. So it is a medical doctor that also does acupuncture?
Yeah.
Integrative medicine. Okay, so one of the weird things that you would see that they do in Chinese medicine, they ask you to stick your tongue out, which is really weird. Say what? And also they take your pulses, and sometimes a doctor does take your pulse, also in Western medicine, but what we look for is a little bit different. So we're going to talk primarily about these two things today, even though when we talk about Chinese medicine, just like in Western medicine, there are four things that we do. Everyone, we always start from inspection. So for the moment you go and you greet your patient that is sitting in the lobby, you're going to start looking. What can you identify about the patient they're sitting? What can you identify?
Posture.
Their posture, their color, what else? Their mood, demeanor a little bit. What else can you just see from them? You can see their age, approximately. You can see their gender, okay, which tells you already several things. You can see the way they walk. You know, if you see that they walk like this, it already tells you, you know, why they come. Are they jumping off the bed? Are they off the chair? Are they pacing? Okay, so you can see a lot of things through just this inspection. One of the inspections that we do also in Chinese medicine is we do the tongue inspection. There is also face reading that you can see from the face. Different organs are also reflected on the face. So these are the things that we can do in inspection. Then there is inquiring. So meaning that you're asking them questions. You're not a clairvoyant. You need to know why they came to see you, so you need to ask them a lot of questions. And we ask questions not only about their chief complaint, but we actually want to get a mental picture of who this person is, what is going on with their life, how is their lifestyle, what stressors they have in their life, what support system they have in their life, what type of job are they doing, because all of these can be clues to what is going on with them, and this also tells you how you approach them. So for example, now I have an astrophysicist that is a patient of mine. So when she asks me a lot of questions, so when I answer, I think about, okay, she's an astrophysicist, I need to talk to her more scientifically. You know, somebody else will come and talk to me. They don't want to get all this explanation. Okay, I'm paying you, you fix me. This is it. Don't bother me with too many things that you say. And then there is listening and smelling. So listening is to listen to what the person is saying, and not only what they are saying, but actually it might be the voice, like, do they talk really loud, or do they talk so softly that you can barely hear what they're saying? Okay, so this can tell you a little bit about their constitution. If somebody has a cough and their cough is, you know, it's one thing, it tells you for the diagnosis. But if the cough is, it tells you something different. So you want to listen to them. Sometimes you need to read between the lines of what they are telling you. And you also, there is smelling. So smelling, there are certain diseases, for example, when somebody has a streptococcal infection and you open the door, you can smell. You can smell that they have this infection. So even though it's not an official thing to do, when you do sometimes 5-element acupuncture, you actually go behind the person and you try to see if they have a specific smell. You had a question?
Yeah, when you use the word constitution, is that meaning the whole person's being, or?
It can be a little bit of their genetics, you know, the person, what they have their tendency, okay? And then there is palpation. So taking the pulse is part of the palpation. You palpate sometimes the abdomen, you palpate their channels to feel. And also if you'll go to a doctor, you know, you'll have your gynecological examination, so they do some palpation. So before we go into that, in today's world, unfortunately, even though doctors are taught all these things to do the inquiry, the palpation, the listening and all these things, because they have to see so many patients, many times what they rely on is, you know, the lab test, the x-rays, what they're seeing, and if the, you know, you can have minor degenerative changes in your x-ray and you cannot sleep at night, and when I ask you how much is your pain, you're going to tell me 11 out of 10 because it's so, but it doesn't correlate with what the x-ray is showing. So when you do your treatment, because in Chinese medicine, the method that they had, because it is an ancient medicine, they didn't have invasive type of thing. They had to take clues from non-invasive procedures to understand what is actually going on within the person's body, and this is how they developed what they have. Today, there are some, you know, machines that can tell you how your channels are going. You know, they have some electrical type of machines, but this is not what we're talking today about. So, when it comes to tongue diagnosis,
I just wondered if you could explain what you mean by a channel.
A channel. So as you can see from these pictures here in Chinese medicine, the qi that Tom was talking about, okay, so the qi is running also within those pathways. So these are the channels. They're from the outside of the body, and they have parts that go inside the body and connect with the internal organs. And you have different types of them. They actually form a sort of network within the body. And there are some areas that electrically are more, there are points, acupuncture points, where the qi of the channel goes more or less to the surface, and then with your needle, you can tap into this, and then you can decide, do I want to disperse? Do I want to tonify? Or do I want just to harmonize? And you use your different techniques when you do. So these are the channels, okay? So I brought here my ugly tongues. So usually the tongue, when a normal tongue is supposed to be tender, meaning it's not a stiff type of tongue, that the body of the tongue, the color is pinkish, so light red, not too pale. They're helping here, so let's take away the distraction, away. And it has a thin white coating. Actually, in Chinese medicine, I say it's like Goldilocks principle. You know Goldilocks? You heard about the story? So one chair was too hard, the other one too soft, but she needed just right. One porridge was too hot, too cold, but one was just right. So this is the principle of Chinese medicine. It has to be just right. Not too stiff and not too flabby, not too red and not too pale, not too thick coating and not having any coating. You just have to be just right. And you also want the tongue to be corresponding with the patient's body. So you don't want to see a tongue that is really big and puffy on somebody that is really small and slender. Okay, so it has to correspond. And as I said before, the tongue is just one clue. And it's not based on this is it, this is what you have. Or it's not based on the pulse, this is it, this is what you have. It's just one clue, and it helps to confirm your decision. And sometimes you totally ignore the tongue or the pulse, and sometimes you take them into consideration. You're just looking for clue to get the puzzle of who this person is. So when we look at the tongue, we look at, you look at the shape of it. So is it narrow? Is it big? Is it puffy? At the size of it, if it's thick, if it's thin. What color is it? Does it have any type of creases in it? Light, if they have little papilla that comes out, red dots like a strawberry. You know, does it have scallops at the end? And then you not only look at the tongue proper itself, but also at the coating. Some people think, oh, they do a favor, they just brush their tongue before they come to see you. You tell them, no, please don't do that, because you want to see the color of the coating. Of course, if they had a blueberry shake just before they come, then it will tint the color. And you want to see how thick the coating is, and also how moist. And again, you don't want it to be extremely watery, and you don't want it to be too dry. You just want it right. Everything tells you, if it's too dry, it means maybe that there is heat in the body. If it's too wet, there might be too much cold in the body. So there are things that can destroy your diagnosis if you don't have good enough lighting. Sometimes if a person wears something that is, let's say, red, I usually put like my hand or a paper, just because it can reflect over their tongue and skewer a little bit my diagnosis, what they ate, and as I said, if they are brushing their tongue. The other thing that we look, different parts of the tongue tell you different things. Different organs are represented in different parts of the tongue. So it goes opposite to the torso. So there is the upper part of the torso that is above the diaphragm. We call it the upper burner. And in this upper side, what do we have here? The heart and the lungs, and they're reflected at the tip of the tongue. And then the middle, below the diaphragm, all the way to the belly button. This is the middle burner, and here we have the digestive organs. So as you can see, the spleen, the stomach, the liver, and the gallbladder. And then below the belly button, all the way to the end of the torso, you have the kidney, the bladder, and also the intestines. The uterus and the ovaries are called in Chinese medicine the peculiar organs. So they are not part of what we call the general regular organs. So if I see that the coating is different, or there are certain cracks in certain places, or one area is really red, then it will tell me that something is going on in that particular area. So just to give you an example, I was at Cabrillo College. There was a health fair, and I had with me the ugly tongues, as you can see, and this woman comes around and she said, "What's that?" And I told her, "Ugly tongues." And she said, "Are they real?" I said, "No, it's just plastic." And then she said, she sticks her tongue and she asked me, "What can you tell me about my tongue?" And I see that in the side of her tongue, okay, liver and gallbladder, she has like purple circle. And I ask her, "You have this purple circle, have you ever noticed that you have it?" She says, "Yes, I have it for a long time." I said, "So did you go to the dentist, you know, when they clean your teeth, did they look, did they say anything?" She said, "No, it's always the same size and stuff." So I think to myself, okay, what can it be? So it's the liver and gallbladder. The purple circle in Chinese medicine means that there is some blood stagnation. And the liver and gallbladder, they're related. The liver can cause headaches, headaches here for the liver, gallbladder here, so maybe she has migraines. So I asked her, do you tend to have headaches, migraine? She said, nah, I'm not a headachy type of person, I rarely have. I said, okay, so the liver and the gallbladder also relates to your periods and to your menstrual cycle. And so I asked her, do you have PMS or clots when you have, blood stagnation, like when you have lots of clots when you're having your period? And she said, no, I don't tend to have PMS. So I said, were you ever told that you have a fibroid maybe in your uterus? And here she was quiet. She looked at me, she turned around, and she left. So until today, I don't know if she thought that I can see through her, I have X-ray vision, or what, because from being a cheerful and no, she just looked and turned around and just left as fast as she could. So we don't know what she has, but this is what it can tell you. So the people today, my kids think, I tell them, 20 years from now, you'll think it's so stupid, but what can we do? So everyone takes a selfie, stick their tongue. I tell sometimes my daughter, you see, Phoebe should not eat too much pizza because she has a tongue like Miley Cyrus. Okay, so what do you see on Miley Cyrus' tongue? If I didn't have light here, and you could see. What do you see? So it has white what? Is the tongue white?
Coating.
The coating looks really white. And does it look a thin coating or does it look a thick coating?
Thick.
It looks like a thick coating. What else do you see where doesn't she have coating?
I was going to say the heart and the lungs.
The heart and the lungs don't have so much coating, looks a little bit reddish. And the coating that she has a little bit look yellowish, a little bit. So when you have such thick coating, it says that there is some dampness. I don't know if she smoked something before, if she ate something that is greasy a little bit. And the heart and the lung, she's a singer. I don't know if she had something going on. Maybe she had, in Chinese medicine, the heart relates also to the quality of the sleep. Maybe she didn't sleep so well before. But if we think that this is Miley Cyrus brought it, we notice that actually it started even earlier than that. So Albert Einstein, it was his 72th birthday, and the paparazzi took a picture of him, and he stuck his tongue to them, and he liked it so much that he decided to make it, he clipped it from the newspaper and made like his Christmas card for his friends was this. So if you look at Albert's tongue, what would you say? What color is it? It actually, to me, it looked a tad red. It's not the best, but I don't know if you can see that it has a lot of creaks, can you see this? You cannot see it. So it has a lot of little cuts on it. It's just, think about it like you look at the earth. When the earth has a lot of, when there is some dryness because there was not enough of water. So he's 72, so his yin a little bit goes down. There is yin and yang. Yin is substance, yang is energy, and as we grow older, actually both of them, the yin and the yang, go a little bit down. So you cannot see, but he does have some cracks in his tongue. So here I brought you 3 tongues. Which one is the normal? The one that is the left, although they have a little bit of puffiness on the edges here, like the gallbladder and the liver a little bit. This one has teeth mark, so it has scallops, and it's a little bit on the pale side. So this person has some digestive issues. I remember one of our students, very tall, very slender type of guy, very sinewy, like the type of guy that would do yoga. You know, yoga, you would not see people that are, you know, muscle type of, it's not the type of guy. And then one day he showed me his tongue and I was like, whoa. His tongue was puffier, bigger than this, and it really didn't correspond with his, you know, the way he looks. So I asked him, what has happened? Why do you have your digestive system? So, because he was eating so healthy, I like, what's going on? And he said he lived in India for 2 years and he got giardia. And it took him like 7 years to get rid of it. So it was showing on his tongue. And this again is a red tongue with some, we don't see it actually so well in this picture. But this one, it's a red tongue, so this person has some heat in his body. It can be an infection, it can be an inflammation, or it can just be that he has, like a woman in menopause, so she has less yin, relatively more yang than yin, so she has like the hot flashes, she, you know, she's feeling the heat that tends to go up in the body. Okay, so now moving on into the pulse diagnosis. There is a special way that we're doing the pulse, and in the Chinese, when you go to an old Chinese person, they can, you know, they look at your, they take your pulse and they take their time. And I remember one of my patients, she came to see me, and she said they could say that when I was 5, I had this and this. And I said, listen, I'm not such a, you know, master to know that from your pulse, what happened to you at the age of 5, you had a fight with Nikki from the kindergarten. So I don't know all these things. So the pulse gives you information about what is happening inside your internal organs, because each position represents another organ. It can also tell you the cause of the disease. So, for example, is it something that you contracted from the outside, like a virus or bacteria or an allergen, or is it something that is more internal medicine? And also, what is the prognosis? Is it something that we will be able to get rid of it quickly, or is it something that is going to take a long time to treat? There are 28 different types of pulses that you learn. They're qualified by their speed. So is it quick or is it slow? The quality, so they have different types of, is it choppy, is it tight, is it wiry, is it slippery? So like, for example, wiry is the sensation. Any one of you play guitar or any string instrument? So wiry is the way, you know, when you have the guitar, it's nicely tight. And this is what you feel when you put your pulse. Sometimes slippery means like the imagery that they give if you have pearls on a plate and you put your fingers gently and it's like bloop, 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 bloop. This is a slippery pulse. Sometimes you see that the pulse is really thin. It's like a thread. And sometimes it's like a thicker thing. It feels really full. And then there is the rhythm of it. Some pulses are regular, some pulses are not regular. Some pulses are irregular, and some pulses are regularly. Okay, so bloop, bloop, stop, bloop, bloop, stop, bloop, bloop, stop, or bloop, bloop, stop, bloop, 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 stop, bloop, stop. You know, they are irregular. And then the depth. Some pulses you can just put your fingers and it comes up, and some pulses, like I'm like doing this because I really try to feel what is going on. I can barely feel the pulse. So as I mentioned, there are different areas. So again, just like the body, it's a reversed map of the torso. So what is more on the tip will be the heart and the lungs. So the heart, you know, it inclines towards your left hand, so this is the first position next to the wrist, and you never check your pulse. We check it on the radial nerve, never with the thumb, always with the finger, because the thumb has its own pulse, okay? So you also put your fingers depending on the size of the person. If the person is really petite, I put my fingers one next to the other. If the person is tall, then I spread them a little bit apart. So you have the lungs on one area, the heart on the other side, and then you have the liver and the spleen. Both of them are in the middle. Jiao, but this time it goes opposite to their anatomical position. So the liver is on your right side, but you will find it on your left hand, and the spleen is actually on your left side, but you'll find it on your right side. And then the most close area to you is the kidney. This is the kidney yang, and the other one is the kidney yin. There is more complex to it, because if you touch superficially, it's the yang organ. You touch more deep, is the yin organ, etc. So this is approximately what we do, and we try to put all these things together. And lastly, just to tell you, I had a patient that came to see me. He didn't want acupuncture, he just wanted a consultation. And I said, okay, so how can I help you? What is bothering you? And he didn't want to tell me anything. He said, I want you to check my pulse and to tell me what I have. And I said, can I see a tongue too? He said, no, my tongue is too revealing. So I'm not willing to do. I said, okay, another one. Okay, so I take his pulse, but meanwhile, as he was talking to me, I could see a little bit his tongue. I could get a peek a little bit of his tongue. Then I put the clues together, and what I felt was that in this position, very deficient, very slippery, that also tells me that the digestive system is not working the best. So I told him, without asking you a question, without knowing anything about you, he was also dressed very much hippie-like, with a flare of, Indian type of dressing up. So I put, just like the guy that I told you, one of our students that lived in India. So I put, detective. So you put a few things together. So I told him, I think that your digestive system there's something wrong in that area. It might be that you have constipation, diarrhea, bloating, acid reflux, gas, whatever. It can distension. And he said, oh man, how can you say this to me? Do you know how many supplements I've been, how many thousands of dollars did I spend to fix it? And I said, and then he told me that he has been living in India, and from time to time he comes to the United States. And I told him, it's a little bit your weakest link, and you need to be careful what you drink and what you eat. And I can give you here some herbs that we have for travelers that are going, so that you can take if you feel that something, a little bug in your stomach, but you need to be careful. And also, if somebody comes to you and they tell you that their digestive system is perfectly fine, but you feel on the pulse that it's not so fine, or if you look at the tongue and the digestive system not necessarily looks so fine, then because the body and the mind are connected together, then if it's not the digestive system, then I ask them, the emotion of worrying and thinking about things over and over and over again. And the people that I see that this is deficient, sometimes if they don't have their own worries, they like to take the neighbor's worries just in case. So you ask them about that, because it's not only digesting food, it's also sometimes digesting idea. It is called in Chinese medicine pensiveness, or somebody that has to use, when you eat, it gives the biggest consumer of glucose is our brain. So if somebody goes through intense studies, then also it can be hard on their digestive system. So we talk about these. So sometimes if I see that the physiological organ is fine, despite the fact that it tells me in the pulse or in the tongue that something is not totally fine there, then I ask them about the emotion that is associated with it. And this is how we work on things. Make sense? Okay. So this is it for today. Yes?
I had just one question way at the beginning. When you used the word position, I wasn't sure if you meant the position of the hand as you're taking it or where.
Both. So there is the position of how you put your fingers. Is it just below the wrist, a little bit beyond it, and more beyond it? And also the different position, like you see the Chinese words for it, Sun, Guan, and Qi. Shi, actually. And then it indicates the different position indicate different organs in the body. Okay, so a lot to learn. If you come here, there is a lot to learn, but it's fascinating, and this is why I'm here.